Hi, everyone. I'm just taking my Be Famous vitamin right now. Just waiting for Dr. Keith Berkowitz to join us. How's everyone today? So I'm excited to talk about the benefits of taking vitamins and how it can help your skin, your body, your hair, your nails, your immune function. Hi. So I'm totally vitamined up. I'm having my vitamin C cocktail, having my Be Famous. I just took that now. Let's see here. Let's get Keith. We're a bit early today. So I turn that off. How's everyone doing?
Hey, how are you doing? Now that
Good.
you're vitamin up, we can start.
I'm totally I've just taken my Be Famous vitamin. Yeah, I've been taking vitamins for 20 years. And, actually prior to 20 years, I've been a naturopathic doctor for 20 years. And then I worked for a vitamin supplement company. So I really got to understand the ins and outs of what goes into making a vitamin, the crappy stuff people put in vitamins. And, when people poo-poo vitamins, I understand that as well. So it's an amazing experience I had. Before I got into university and med school, I learned so much about vitamins and nutritional supplements in general.
Yes, I remember my first introduction was I remember having breakfast with Dr. Atkins,
Okay.
and he actually pulled out his vitamin pack. It was about 90 pills. So we couldn't order until he finished his 90 supplements. But it's interesting as we learned over the years and how important, supplements are to health. And COVID-19 of everything has really taught us more than anything else, that survival really is based on having adequate nutritional vitamin and supplement levels.
I mean, let's look at the general American diet, right? So what does it consist of? Artificial flavors, pesticides, chemicals, sweeteners, sugars, artificial sweeteners, antibiotics in the meat preparation. So if you're taking antibiotic, even if you cook the meat, it still has antibiotics in it. So you're taking like all of these, some of them low level,
Hmm.
pesticides. And we talk about things like B complex, for example, this is one of the vitamins that I highly recommend because our diets cannot be rich enough with B complex vitamins because the artificial flavors and all of these sweeteners rob our bodies of the these B vitamins, and B vitamins are specifically good for the immune function. They're important for hormonal metabolism. They're good for energy, our mitochondrial function, our brain function. So I want to start off with B complex, and I want to ask you, Doc, how you're using B complex vitamins. I know I created this one specifically, and I know you've used it clinically as well. And just sort of explaining people that not all B complex vitamins are created equal.
You know what's so interesting about what you were saying? Think about what happened in the food supply, right?
Yeah.
Probably in the 70s, you started seeing foods fortified with B vitamins, right?
Yes.
So the fact is, grains are one of the greatest examples. We've already recognized that for now over 50 years, that our diet was deficient in B vitamins. So we've known this. This is not new. And I think one of the things you brought up that's so important is I think we normally don't think about is taking things in balance, right? We've talked about this over and over again. People really know B vitamins. They know really B12 in general. And maybe some people know folic acid, but people don't realize there's B1, B2, B3, B9, B17, and the list goes on, B5, B6, that those are actually important. I almost think of assembly line, right? You need each part of the assembly line to put the product together. So having just B12 and folic acid, you're not going to get a complete product. And it's not going to work completely for our function. You need all of them in the right things together. And I think you've done that really well and effectively. And we talked about hormones, cortisol, blood sugar, all the impact, stress that B vitamins play a role.
Can we go through all the B vitamins and sort of talk about the clinical relevance to them?
So we could start with B1, right? B1, which is thiamine.
B1, number one.
Right. So thiamine is really important. Thiamine actually is used, it's famous for people who drink alcohol and be deficient. And that actually, whoops, sorry about that.
Are you okay there?
Technical difficulties. Medical doctors and technology not always work together.
So B1 and alcohol, I mean, that's
Right.
Wernicke-Korsakoff syndrome that, we study. People who have excessively high alcohol intakes tend to get a B1 deficiency. But we know even people that drink moderately get a B1 deficiency.
Right. Yeah. And what's also interesting, I've learned in this whole COVID, crisis that when people have overwhelming infection, thiamine actually gets rid of the acidic products in our bloodstream. So
Right.
things we call lactic acid. And lactic acid is well known for both people with muscle issues, right? After you work out very heavily, you get that muscle tightness, that muscle fatigue, that pain,
Yes.
that cramps. That's actually lactic acid. So thiamine is actually needed by your bloodstream to clear that, so that
Right.
your muscles can function again. Really important. I think people don't realize that. And most of us now, because of COVID and weight gain and all the things, are focusing now on exercise again. And,
Yes.
B1 is really, really critical in an exercise program.
So everybody think of it this way. B1, if you've been drinking too much alcohol over the Christmas and New Year's, you need vitamin B1. And if you're exercising now because you're trying to get into shape like me, I've been on my Peloton almost every day and been working out every day. And I'm feeling that lactic acid. So that's why I took my Be Famous today. So that's B1. And this has 100 milligrams of B1, which is a really, really nice dose to actually get you therapeutic results.
Yeah, and actually that's the dose we actually use even in overwhelming infection. That's the critical dose that we tend to use. So next we have B2, or riboflavin.
Yes.
The riboflavin is really interesting, right? So I don't know if anyone who suffers from headaches or migraines, one of the treatments for migraines is actually riboflavin, or B2. Really kind of critical. So we use that a lot in that aspect. It helps really relax blood vessels and lets your blood flow in the brain really be much more functional.
I had an interesting, I wanted to add on to that. I had a patient who had chronic ocular migraines. I get them as well. This particular patient had such bad migraines. I mean, we got her off all her food intolerances, but I put her on a B complex, and within a week, she hadn't had an ocular migraine at all, like not even one, when she was having 3 or 4 a day. So the riboflavin is really, really super important for ocular migraines and strengthening that particular area in the brain.
So next we have B3, or niacinamide, right? Niacinamide.
Niacin.
Excuse me. I always confuse those two. So niacin's pretty famous, right? Anyone who's had their cholesterol measured, we talk about niacin as a form of helping raise good cholesterol. It's really well utilized for that. But it also has a lot of actually protective effects on the nerves. Niacin has an effect on nerve function. It has also an effect on actually mood. It's really interesting. People that have MTHFR disorder, and we've talked about this before, who don't respond to folic acid really effectively, niacin can help the body actually utilize folic acid better.
Right. And that's why it's super important to take the B vitamin. We'll talk about it at the end, why it's important to take it together. And also we've seen really, really good literature on niacin with LDL cholesterol, lowering
Correct.
the bad cholesterol in the body and reducing arterial plaques in the arteries, in the walls of the artery.
And what's interesting, if you actually look at good and bad cholesterol, good cholesterol, every 1 point you raise in good cholesterol lowers risk by 1%. So it's really tremendous. And most events, actually, what's interesting, you actually see with people with low good cholesterol.
It's pretty incredible. All right, so we look at that, and we also know that niacin is really good for something you really like to talk about, blood sugar.
Yes.
So niacin actually helps proper functioning of blood sugar and glucose into the cells. So really important to take that for blood sugar as well. So that's we've done B1, B2, B3, and now?
B5.
B5, tell us about B5.
So
I love
B5,
B5.
pantothenic acid. So,
Pantothenic acid, yeah.
so I got introduced to pantothenic acid actually when I first started in integrative medicine, and it has actually a role to actually lower triglycerides. So that's where I got first introduced. So one of the first treatments I used in my practice was pantothenic acid to actually stabilize cholesterol by lowering blood triglycerides, which often go up when people consume too much sugar or too much heavy fats. And that's where my introduction was. But in things like when you talk about hair loss, stress, allergies, it plays
Yeah.
immunity plays a major role in that
Immunity.
aspect.
And we also know that pantothenic acid is one of the B vitamins that the adrenals completely use all of when you're under stress. So guess what? For the entire year of 2020, going into 2021 now, we are using B5.
Yeah, I think stress is up there, isn't it, these days? Huh?
I think just a little bit, just a tiny bit. So, you know, again, B5 is one of the B vitamins that you will burn out, and if you're under a high amount of stress, that's the first vitamin that's going to be completely burnt.
Hang on, I'll be right back. I'm going to get some.
I'm going to give some to you virtually, Keith. Here, take it.
And then there's B6. I know B6 you love talking about. So B6 is a really interesting one, pyridoxine. And what's interesting about it, it's actually lost oftentimes because people we talk about homocysteine, you have B6, B12, and folic acid.
Right.
Everyone talks about B12 and folic acid. B6 is kind of that little
Always
brother or
left out.
sister that's left out. But it's actually important for homocysteine. And homocysteine is such a tremendous marker we've learned from memory, from immunity, from inflammation, really kind of critical. And someone, you know, and oftentimes we'll do B6 in 50 milligrams, so 25 to 50 milligrams, up to 100 milligrams. And it also helps your body detoxify, which I know is so critical when we talk about skin health, right? Before we can put the good stuff in, we got to get the bad stuff out.
This B famous has 50 milligrams of B6 as pyridoxine. So really perfect dose for, and also for anyone who is suffering from PMS, premenstrual syndrome, or problem is a male species. I was waiting to see if you were paying attention.
Yeah, I was trying to ignore that, by the way.
So B6 really, really good for anyone who's experiencing PMS, like craving for chocolates, breast tenderness, you know, water retention, any of those people that are like, I'm completely swollen before my period, really good to take the B6. And again, this has all of them in there, and we haven't finished talking about the rest of them. Can you talk about folate as 5-methyl tetrahydrofolate?
So folate is B9. So, and actually someone asked the question about homocysteine. Homocysteine is a mark of inflammation. That's a measure of B6, B12, and folic acid or B9. So folic, I mean, that's kind of become like the next most important one after B12. And folic acid has a role in everything from brain development in babies to mood stabilization. Folate, when it becomes methylfolate, is so critical for neurotransmitter production, right? Which is so important for proper red blood cell function, right? So our blood cells can deliver oxygen. Kind of important, right, for our body. We need a little bit of oxygen.
And if you think about the World Health Organization states that so much of the world is iron deficient anemic. And so we need this to rebuild red blood cell counts in people who are anemic.
And what's interesting about that, we often think that anemia is actually iron deficiency, but that's only part of anemia. Anemia can also be folic acid and B12 deficiency, and that could be just as problematic. And actually, as people get older, it's really interesting when you look in younger people, you often look at iron deficiency, especially women in their menstrual years, right, from their menstrual cycle. But as people age, it's really interesting. A form of anemia changes. It becomes more and more common for B12 and folic acid to be deficient. And especially people that take medications that can, often cause that as well.
Now,
and then, go ahead, I'm sorry.
No. So we're going to go on. So that was 5-methyl tetrahydrofolate.
Or B9.
Or B9. And, why this is the methylated form. So this is the absorbable form of folate, not folic acid, which can build up toxicity in your system. This is also good for people who have what we call methylation defects, MTHFR defects. And we talked about that last time. Keith, you explained it so well last time. I love the way you explain things.
So it's much more common than people think. Some of the population can be as high as 25%. So what it is, it's the inability to take folic acid and convert it into a form that's usable, especially by the brain. Methylations is the process of adding a methyl group onto a product, folic acid, so that it can be utilized and cross the blood-brain barrier effectively. In its methylated form, that's where neurotransmitter production happens. You know, serotonin, dopamine, norepinephrine, small things we need are really reliant on that methylation process.
And so when we see patients clinically, Keith, and we put them on like I put so many patients on the Be Famous, and you know, people who have methylation defects, you know, they stay on it forever and ever. They take one a day, and their homocysteine values reduce, which is incredible because that's an inflammatory marker. And you're reducing that inflammation. And they also feel better. Their PMS is better. Their cycles are better. Their mood is better. Their energy function, their ability to, their mitochondrial function. So really super important. Also, if we look at the next B vitamin, do we missing another B vitamin?
Biotin. So
Yes.
biotin, I think, is B17, right? B17.
Yes.
I think
Yes.
So I know you like to talk about skin and nails and hair. There you go. Biotin is really critical for that. So, I mean, really
I tell
important.
you, my hair is like growing like a weed because I take the beauty in a bottle every day. This has a lot of biotin in it.
Thanks for rubbing that in. I really appreciate that, for emphasizing that.
Keith, you look great. Your skin looks great.
Well, that's your doing.
And you don't, I
So,
mean, a lot of men lose their hair around, you know, there's some genetic.
30, age 30, you know.
It's nice. It looks good on you.
Thanks. So biotin's so critical for that. And actually biotin also has a role in blood sugar. So it actually often is your natural version, we call it metformin, which is a diabetic drug, and it helps regulate blood sugar as well.
Which is super important. And we see a lot of people with acne, with, you know, brittle nails. I mean, like my nails are all different sizes. My apologies. I haven't had a manicure at all. So, but they're strong. Like they're really strong and healthy because I take, we'll talk about the next product in a bit, but we're just finishing off with Be Famous. This does have some biotin in it, about 2 milligrams of biotin.
So what's interesting about biotin, people forget when they think of hair, and hair, you know, hair is so important as part of beauty and daily. It's the strength of the hair. So it's, people have two issues with hair. They lose hair, but also you want strong hair so that the hair doesn't break and crack, especially when people take a shower, and people forget that's what also causes a problem.
You can take too much biotin as well, and there are side effects for certain individuals. You know, I've seen people break out more with acne. There seems to be some kind of there seems to be some kind of absorption issue, or I need to look into it more, but it's to do with the detoxification pathways. And
high levels of biotin can actually affect thyroid function when you draw the blood tests. So a lot of the blood is safe for thyroid is actually impacted by biotin. So you have to be careful.
Right. Exactly. That's a good point. Sorry. And anyone that missed that, because you froze there for a second, anyone who's taking biotin with thyroid medication or are getting their thyroid test results done, you might see changes in those. So I recommend coming off the biotin before you do your thyroid testing. Okay. And wanted to talk about trimethylglycine because it's a nice addition to this as well.
So trimethylglycine is really interesting. So that actually helps with homocysteine. So it actually helps your body utilize better folic acid, B12 and B6. So it's important. So really good homocysteine preparations, you know, from a supplement will always have we call it TMG in it as well.
Yeah, that's great. And it's kind of like a carrier. It helps all of those. And this is what's in this formula. You've got B1, B2, B3, B6, folate as 5-methyl tetrahydrofolate, B12. We didn't talk about B12 as methylcobalamin, because methylcobalamin is the form that's most effective for everybody for brain function, which I think is super important right now.
Yeah, so B12 is kind of like one of those mother vitamins. It does so many different things, from maintaining proper red blood cell function, for immunity, keep the nerves working properly. And actually, what's interesting, in the winter, we often use it for mood stabilization. It's a great antidepressant when used to help mood stabilization as well, too, from that aspect.
Awesome. People that get B12 shots and things like that, to improve mood and to improve energy. This is a very strong dose of B12. This has got about 250 micrograms, which is quite high, of the methylcobalamin, which is it's a better form of a B vitamin complex, B12. And so this is, everything we talked about is in the Be Famous. It's a 1 a day and really easy to take with food. A lot of B complexes give me stomach aches. This one doesn't. I made sure that we made it in a vegetable capsule that's soluble, that's not going to sort of sit in your intestines and make you sick. The next one we're going to
And actually, one more thing of that. When you urinate, it will turn your urine yellow. So don't be surprised. And that's okay.
Exactly. Yeah, just full disclosure here, you're going to have yellow looking pee. That smells like vitamins.
And that's okay.
It's a
that's the normal effect.
sexy smell.
And the reason is that the body's really interesting. Most of the B vitamins, except for B6, we can't really overdose because the body has a mechanism to get rid of what it doesn't need.
Exactly. So the next one we have is Beauty in a Bottle. And why I called it Beauty in a Bottle was because it has all the vitamins and minerals that are good for your hair, skin, and nails. So I was always, Keith, I would wake up some days and look at my legs and my arms, and they would be looking like reptiles, like skin of a reptile, like really funny looking, dry, scaly. And, I realized that I was deficient in vitamin A, but what I didn't realize is I was also deficient in C and E, all those vitamins together, that they work synergistically. And I noticed that by physically taking, when I would only take vitamin A, I wouldn't see a result. When I would take A, C, E, zinc, selenium together, I would see a result. So this has a really nice synergistic complex of A, C, E, zinc, selenium, hyaluronic acid, proline and lysine, along with, we're not going to go through every single one, iodine, but we'll go through some of them just to explain the importance of this. And why I created that is so that I could have one supplement that I could take that could act as a multivitamin and also help my hair, skin, and nails, and my immune function, and my collagen production. Because I'm now 48 years old. I want my skin to be hydrated and younger looking. I want the precursors that are going to increase collagen production. And so we look at things like proline and lysine, which actually help produce collagen production. Keith, any feedback on some of the ingredients in
So
here?
let's talk about lysine. I think you brought up one. Lysine is really important because people who are vegetarians, they can often be deficient in lysine. That's really important. And lysine also, because it's also very good antiviral. So besides the effects on that, is really critical. The other one I really like is selenium. So we talked a lot about thyroid function. Mm-hmm. Selenium is really one of those critical components of thyroid function. Selenium is great and actually helps with getting rid of free radicals, right? You talk about skin damage, right? One of the most problems with skin damage is the buildup of these free radicals or oxidized particles that the body can't get rid of. So you need selenium to help get rid of that. Before you add back, you want to get rid of always what shouldn't be there. And selenium has a big role in that. I like you to talk about hyaluronic acid. That's a big one that's really become popular. Everyone uses the term collagen. Yes. Collagen. We need collagen for proper skin, for our joints to work properly. And now the hot term from that is hyaluronic acid.
Right. And it's internal hyaluronic acid. So it's not just helping, it's helping from the inside out.
Right. And so actually, I always think of it as it's like the cushioning. It helps increase the cushioning. So the sponginess, right? So you want skin to have flexibility, right? When you grab your skin, you want to be able to pop in and out, not to be unflexible. And as we age, skin loses that hydrating effect or the ability to have that flexibility. And hyaluronic acid is one of the key components of that.
The other reason why I created it as well, Keith, was for anyone who was taking a thyroid medication, because of the fact that it has the selenium, it has the iodine, it has the ACE zinc, it has all of those vitamins in there. It has some B vitamins, but not as much as a B famous. If people are taking these two together, you can actually maybe only take the B famous like 3 times a week and take the beauty in a bottle every day. So 2 capsules a day with food of the beauty in a bottle. And then this you can take, it's about 3 to 4 times a week, so that you're not overdosing on the biotin in each.
And you bring up a good point, because one of the things, people talk about taking collagen and how important it is, but people forget you need vitamin C, you need selenium, you need zinc, all those things you need before your body uses the collagen. So if you don't have those on board first, you can take all the collagen you want and your body's not going to know what to do with it. Really critical.
It's a good point. Going on to vitamin C, I am drinking my vitamin C cocktail. This just came out in literally in September. It just is delicious. It tastes like basically a creamsicle. It's a passion fruit flavor, and it has superberry, antioxidants, zinc in it. It also has a high dose of vitamin C. It has 1,000 milligrams of liposomal vitamin C, which is much different than taking a regular vitamin C. Keith, can we talk a little bit about that?
So it's interesting. So remember, when things are fat soluble, they actually penetrate the cells much better. People forget the layer around each cell is called the lipid. Lipids are fats. So lipids actually enter lipids much easier than other products. So when it's water soluble, which is typical vitamin C, probably about 10% of that's being utilized by the body, if we're lucky. That's the high end. Whereas if you make it lipid soluble, and you've created that by adding something called phosphatidylcholine to bind to it, actually it becomes bioavailable up to 90%, which is great.
This is all the ingredients are on the back. So you have the pure whey vitamin C, which is the strongest, most well-researched form of vitamin C, the Vitaberry Superfruit Blend, the zinc and phosphatidylcholine. I mean, again, the reason why I created these supplements is I really wanted them for myself and my skin and my immune function. And I knew my patients would enjoy them as well, because it's hard to find a good vitamin C that's not going to cause you to have diarrhea. First of all, it's not even going to be absorbed that much. So it's like taking vitamin C and it's coming right through you.
And that's the great point of the fat soluble. It doesn't cause the people use vitamin C as a laxative. The liposomal or the fat soluble version doesn't create that issue.
Right.
And I think you talked about something so important. And again, the stages of really repairing the skin, getting your skin to be healthy, your hair, your nails to be healthy, is, remember, you always got to get rid of those toxins, the free radicals. So a lot of the supplements work on that process to detoxify, to tell the liver, okay, let's get rid of this stuff. Then you want to add back, we call the substrates, the B vitamins, the vitamin C, the hyaluronic acid, that actually create the foundation for your body to work for itself. That's really the key. We forget that. We want our body to do the work for us, but we need the foundation to do that. And then, the healthy other things you do, you'll talk about later, for your skin, that works after you have that. And someone asked before, do the supplements work with a bad diet? Supplements will work, but they're more effective when your diet is good.
The body has an innate ability to heal itself if given the right environment. And when you're giving the right environment, it's just supplements into you're taking the right supplements, it makes a huge difference. You can definitely take vitamin B, C, and D together. Absolutely. I would recommend, though, with vitamin D, you have to have it with food. So you have to have it with like an avocado or some kind of fat that increases the absorption of the vitamin D. In terms of liposomal vitamin C, in terms of comparing it with other brands, I've sent other liposomal vitamin C's to the lab, and unfortunately, not all liposomal vitamin C's created the same. That's why I spent a lot of time working with a team of people to make sure that this is 100% liposomal, and that it has other benefits to it just besides the vitamin C, because it works better when you add it with zinc, and it works better when you add it with superberry antioxidants. And 90% of this gets absorbed, and it tastes delicious. Again, and it also, Matt, like if something is working for you, stay on it. But you know, if you want to try something different, and what I've noticed actually myself is my skin. You can really see a change in your skin. Did you notice that when taking it? Like I really saw.
Example number, patient 0 is right here. So actually, I've noticed tremendous difference in my skin clearing up, because I do struggle a lot with my breakouts, especially when I'm under stress. And this has made a tremendous difference. Stress hasn't gone away, but the breakouts have.
That's good to know. I really, like, a lot of my patients were like, I love the taste of this. I've even stopped drinking alcohol. This is like my drink that I have every day now. And they really notice a change in your skin. I actually notice this change all over my body, not just my face. So it's an interesting thing how vitamin C actually increases collagen production. And if you take the right form and you absorb it, it's incredible. All right.
So prior to October, I was 51. Now I'm 41. Yeah, if you haven't noticed.
You do. You look really good, Keith. You
It
look
actually,
great.
and you've talked to me for years. I've always struggled with that,
Yeah.
and that really, more than anything else I've added, has turned my skin around tremendously.
Oh, I'm so happy. I'm so happy. Well, you look great. All right. So probiotics, Keith. You know, because anyone that consumes meat on a, you know, weekly basis, there are antibiotics in your meat. You know, like you're taking a low dose of antibiotic, basically. You know, like how can we, you know, even revert? Like, I mean, that's why we're all a mess. We all have IBS. You know, we have all kinds of. Somebody likes your smile. I like it.
Thank
The probiotics just really, they're kind of like the Buckingham Palace guards. They sit
I
in
like
the
that.
front and they guard the gut of any pathogens that could come in, any candida, any bacteria, any parasites. It's sitting there like Buckingham Palace guards. And what it does also is it increases the absorption of various vitamins and minerals as well. So when you don't have probiotics, you can actually increase your risks for leaky gut. Remember, leaky gut looks like this. A normal gut looks like that, nice and flat. The bacteria and the food intolerances can't get through the gut lumen into the blood to create an immune response. So we know that this probiotic guards and prevents leaky gut from happening. And this also has grapeseed extract in it. It's 20 billion CFUs. The other thing I like about it is it's a DDS1 strain. And what that means is that it's been tested for over 50 years. And we have bile acids. We have the gut is very treacherous place. When you eat stuff, your stomach acidity is like between 1.2 and 2, so super acidic. So anything you eat, your stomach literally kills it. You know, any bacteria, any parasites, except if you're over the age of 40, chances are your stomach acid has gone a little alkaline, and therefore you're more susceptible to bacteria, yeast, all sorts of stuff. Why I'm saying this is when you take yogurt, people are like, well, I'm going to take kefir or yogurt. That's going to help. Absolutely. There's some great bacteria in there, but by the time it's counterproductive because the dairy's bad for you, number one. Number two, the stomach acid is so acidic, it will just kill that great bacteria.
And
So,
again, no one's, you know, it's important to see that, to get those without having them. Remember, people forget, you want that probiotic to get to the small intestine, right? You want it to get through the stomach to get to the next stage. The small intestine is where most of your food absorption happens. You need that good bacteria to do that. And I think that's probably our next epidemic, right? We talked about vitamin D deficiency. I think it's probably also beneficial bacteria deficiency. And I bet you that's probably almost everyone in general has that deficiency. And that's a balance. I almost like the seesaw. What ends up happening if beneficial bacteria low, the bad guys take over. You get the abnormal bacteria. And that's the key. You want to keep that balanced. And I suspect probably most of our population has that issue.
oh, 100%. I don't know anyone who has an optimal gut digestion. And, you know, all the Christmas eating we did, I had all the 4 faces of aging. I basically had Christmas face, which is gluten face, dairy face, sugar face, and wine face. I had all of them. And, you know, it's fine. But now I'm back on it and my skin is, you know, resolving. I'm taking my supplements. I'm exercising. I'm eating well. So the body is very resilient, you know. So, you know, don't be hard on yourself if you did indulge a bit over Christmas.
You can always, you know, the great thing about this is you can replenish your good bacteria, right? So
Yes.
even though they've been beaten down and attacked, you can bring them back. You bring your new army in to take over from the old army. And
I love it. It's like I'm bringing sexy back, whatever. What is that song called? I'm bringing vitamins back. I'm bringing my body back. That's what we're doing. That's why the human body is so incredible. That's why I became a doctor, because I literally found the human body so incredible. Like the liver's ability to regenerate, like how we're able to come back from things. Like we're so resilient as human beings. And so I think that's the takeaway that I really want you to think about, because, you know, even though people feel guilty, you know, I've messed up my body all these years, it's never too late to take charge and get on an eating plan that's good for you and get on a supplement plan that, you know, is required, because we know, and I hate saying this, but a well-balanced diet is super important, but you need vitamins and minerals. You absolutely need it. No questions asked. I've seen patients for so many years. I can tell you it makes a huge difference.
do you know what I always find a good way to kind of think about it? I always think of today as the first day. So every day is the first day. So tomorrow again is the first day. So if you think of it that way, you make sure you do everything right the first day.
Wow.
And every day could be that first day.
It's brilliant. I like it. I like it. Okay, we're going to talk about vitamin D. That next one. This is vitamin D sun with K1 and K2. Keith, take it away. Nobody explains it as well as you do. You're just
So wow, now there's pressure on me.
Yep, the pressure's on.
Vitamin D, I mean, I don't think it's the one probably nutrient that doesn't need any introduction, right? You turn on the news, you turn on the internet, vitamin D, COVID-19, vitamin D protects about 54%. There was another study that actually showed that people low vitamin D had a 4 times greater risk of dying from COVID-19.
Yes.
So vitamin D does everything. It protects our immune system. It helps us deal with pain, which is such an interesting thing. It helps protect our skin, right? We talk about skin issues from eczema to psoriasis to acne. Having inadequate vitamin D is really kind of critical. Actually, if you look at some of even the conventional treatments, they use vitamin D analogs to treat skin a lot of times to overcome that. So that's really critical. It actually helps make your neurotransmitters. It makes your hormones. It's one of the, unfortunately, it's a fat-soluble vitamin, so we actually need to take it. Unfortunately, our body doesn't have enough. Unfortunately, the sun, especially now we're in January, as I look outside, there's not too much sun. You probably have a little more than I do.
I do.
That we're not getting adequate amounts, so we actually need to take it. And I think I've read studies 80-90% and maybe even higher that are deficient. And I think one of the reasons for that, and I see this with patients, they're like, well, my D level's in the normal range of my blood tests, but I think the blood tests are probably outdated, and so that we actually need a little higher levels of vitamin D than we previously thought. And my newest learning thing, vitamin D actually regulates your blood pressure. Who would know? It's now, you know, people take blood pressure pills. I take my vitamin D, and my blood pressure is regulated from that. So it's really critical. And as you said before, must be taken with food. It's a fat soluble. It needs fat to really absorb effectively.
The way I also look at vitamin D is, look at us today. We are on our tablets. We're on our phones. We're exposed to blue light. You know, I have a feeling, and I think you and I talked about this, is that the reason why we're not absorbing vitamin D from the sun like we used to be able to is because we are now exposed to more blue light. And what messages is that telling our body and our pineal gland? And in you know, what is it telling our body when we're on these artificial lights that our body is not used to?
You know it's a big problem when you go now to get eyeglasses. One of the things they ask you, do you want something to block blue light? Right? I mean, if you think about that, it's now part of nature. I mean, we're on the computer all the time. It's part of our regular day that we see so much blue light. So it's so important. And you talked about vitamin K. Vitamin K is one of my favorite. It's one of the ones we don't talk about a lot. And vitamin K1, vitamin K2, really important from things from bone health. And we know that if you take a large amount of vitamin D, you also need vitamin K because it will be depleted. And protecting our arteries, heart health, vitamin K is so critical that it helps keep those blood vessels kind of elastic and clear. That keeps our skin, keeps our, body healthy, keeps oxygen delivery to be maximized. I know you've always taught me one of the keys to healthy skin is enough oxygen. So that vitamin D and vitamin K really critical for that.
Super critical. And also vitamin K is like piggybacks vitamin D into the bone as well. So people who have this low-grade osteoporosis or osteopenia, vitamin D alone is not going to get your bone density levels up. You need K1 and K2.
And people talk about bone density. It's such an interesting topic. It's good to have a lot of bone, but what's really critical is bone strength, or what we call bone matrix.
Right.
And that's where vitamin D and vitamin K are so much important to really maintain that strong bone, what we call bone matrix. And unfortunately, we don't have a good measure of bone matrix. So we actually have to just on our own make sure we have enough in our system. The only thing about vitamin K, you have to be careful if you're on a blood thinner, because it can interfere with that body's ability to thicken or thin its blood.
And definitely take it with avocados because it's a good fat. It's good.
That's my favorite fat.
I just had a whole avocado this morning. Again, you remember, we are not your doctors, so we don't know what your vitamin D status is. We don't know what your gut bacteria looks like. So always take the advice of your practitioner if you're not sure about something. If you've tested vitamin D deficient before and you haven't replenished it, chances are you are still deficient. Vitamin D doesn't just make up for itself through diet, sadly. So, it's super important. And if you're darker skinned as well, you're going to have a higher susceptibility to having low absorption of vitamin D. So, that's why we're seeing the darker skinned individuals being affected more by COVID, because their vitamin D levels are deficient. So I'm recommending 5,000 IUs a day to my patients with K1 and K2. And for those that cannot absorb vitamin D, it's a really good product. It's called Vitamin D Sun. And so super important, though, to speak with your practitioner if you're not sure about which vitamin D to take. This is, again, clotting issues. Be super careful. Do not take the K1 and K2. Anything else we missed, Keith, on taking vitamins in general?
So, I know you talked to me before about talking about COVID a little bit. So we can,
yes. I want to
So we'll talk a lot. So one of the things that I've seen in my practice, so people that have gone sick with COVID, or we call long haulers, who really still linger, one of the key concepts we're noticing is actually low vitamin C and low vitamin D levels. That group tends to actually have more problems post-COVID, at least anecdotally we see in my practice. And actually we're seeing in some of the sickest individuals and that have actually been in the intensive care unit, may have required mechanical ventilation to breathe. They're actually now seeing that ultra high doses of vitamin C and vitamin D are really effective in helping them turn around against the virus.
It's really incredible. And we're seeing these doses of high vitamin C intravenous. People who are still having symptoms like 6 to 8 months after being tested positive for COVID.
So in the intensive care unit, we actually started using up to 6 grams. Now people are actually getting 50 grams. So they're getting 25 grams twice a day. And I also, you asked me to talk about a drug that we're now looking at called ivermectin. We've talked about that before. Ivermectin is an anti-parasite drug. It's actually probably the most prescribed drug in the world. It's been given about 3.7 billion times. And people really think it's actually at the level of penicillin or aspirin from a need around the world. And where it works in COVID-19, we're learning, is it actually blocks we talked about before the ACE2 level where vitamin D stops the virus from getting to the cell to begin with.
Right.
Once it's in the cell, the virus wants to get to what we call the nucleus. The nucleus is kind of like the control center of the cell. That's like your headquarters, the bridge on the ship. So in order to replicate and spread, it has to get into that nucleus. It actually needs this thing called a cargo protein transporter. So almost think of ivermectin as the thing guarding, preventing that transport protein from entering the cell. So it actually looks like it actually maybe effectively block that. And so where it's useful is going to be in both prophylaxis, where we see people whose family members have had COVID-19. Number two is an early treatment, outpatient treatment, and it may actually be 2 doses that is all is needed to be effective, a dose on day 1 and a dose on day 3, typically around 12 milligrams. And then also where we've tried is in long haulers. There's one study out of Peru where it's a small study because we're now starting to look at it. They looked at 33 patients, 8 to 12 weeks post-COVID that were still symptomatic. One of the thoughts, and there's articles now recently published talking about COVID really easily getting into the brain. And that may be causing what we call viral encephalitis and these other symptoms that go fatigue, sense of smell, body aches. And in this group out of Peru, they got 2 doses of ivermectin, day 1 and day 2, and immediately 88% actually resolved their symptoms.
That's incredible because it seems to detach it to prevent it from going any further. So it just feels like the virus continues to replicate even once in your body. And that's why you go from feeling good to not good. So, you can get down viral load down at some points, and at some points you don't. It reminds me of HIV in a way. You know what I mean?
Very similar, yeah. HIV or Lyme disease in some people. What's really interesting, and I'm starting to notice that I want to do more research on it, is some people actually have very prolonged antibody response. Like I was telling you yesterday that I had a patient that 9 months later, he still had antibodies. And actually, interesting enough, he was still symptomatic. So I wonder if there is a correlation with people that have a prolonged antibody response and post symptoms, or we call long hauler symptoms.
Absolutely. And again, with viruses, you and I have talked about viruses forever and ever and ever, cytomegalovirus, Epstein-Barr virus, they're all very, very sneaky viruses that cause other conditions, including autoimmune. So this is why it's super important to take your vitamins, stay healthy. This is not just preventative, guys. This is also for treating anything chronic. So vitamin D, think of vitamin D as an anti-inflammatory. Think of vitamin C as guarding your immune system and supporting your immune system, and also supporting your skin collagen. B vitamins, think of those as supporting your energy levels, your adrenal function. Also your neurotransmitters, your feel-good hormones. And then beauty in a bottle, we want to look at things in there for hair, skin, and nails, but also for the immune system. Lysine, super good for viral issues, cold sores, fatigue, collagen production. I mean, it's,
And actually, I want to stop you for a second. So
yes.
Cold sores is a herpes simplex virus.
Yes.
Lysine's a very good preventative for herpes. I mean, and I think more and more people suffer from it. I think it's about 70% of the population has herpes simplex 1, which is the virus that causes cold sores. And again, when your body's under stress, these things tend to come out. And again, no one has stress right now, of course.
No one.
But stress is so high, so it's now more important than ever to make sure your body has what it needs to be able to combat it effectively.
Amazing. This was so much fun. And I know we have another meeting, another Zoom meeting or lecture rather tonight. I'm really looking forward to that. Let us know what you want to hear next week on Wellness Wednesday. I think you and I talked about it. We were thinking about talking about chronic fatigue syndrome.
Actually, next week's going to be on fatty liver.
Oh, sorry. Yes, fatty liver. Anyone want to talk about
so
fatty
appropriate
liver?
Post-holiday, right? Post-drinking and stuff. Really kind of the most critical time to talk about it. I think most of us are having issues where our liver's like, okay, I need a vacation.
Love your liver, guys. Love your liver, and join us next Wednesday on Wellness Wednesday at 11 a.m., 2 p.m. Thank you, 2 p.m. Eastern Standard Time. You guys, thank you for joining us. Keith, I will talk to you later. And send me a message if we missed anything or if you have any particular questions. Remember, we're not your doctors, so we can't particularly look at, sorry, we can't look at your particular case. But thank you for joining us, and we'll see you next Wednesday.
Have a great day. Be safe.
Be safe, everyone. Bye.